Which of the following maintains the lumen of the trachea? A. Air pressure within the respiratory tract. B. The tracheal cartilages. C. The infrahyoid muscles. D. The cervical spine. The answer is B. The tracheal cartilages. The lumen of the trachea is maintained by the tracheal cartilages, a set of approximately 20 separate C-shaped rings of hyaline cartilage. The non-continuous cartilage allows for greater flexibility during inspiration and expiration. Which of the following best describes the epithelium of the trachea? A. Pseudostratified columnar cells with cilia and goblet cells. B. Stratified squamous epithelium with cilia and goblet cells. C. Cuboidal epithelium with cilia and goblet cells. D. Transitional cells with cilia and goblet cells. The answer is A. Pseudostratified columnar cells with cilia and goblet cells. The epithelium of the trachea is made up of pseudostratified columnar cells with cilia and goblet cells. What structure is directly posterior to the trachea? A. The pharynx. B. The thyroid gland. C. The esophagus. D. The cervical spine. The answer is C. The esophagus. The esophagus is directly posterior to the trachea, and the cervical spine is posterior to the esophagus. The thyroid gland is anterior to the trachea. The pharynx is superior to both the trachea and the esophagus. What does the trachea bifurcate into? A. Left and right primary bronchioles. B. Left and right secondary bronchioles. C. Left and right secondary bronchi. D. Left and right primary bronchi. The answer is D. Left and right primary bronchi. The trachea bifurcates into the left and right primary bronchi. This occurs at a location called the carina, which is at the level of T4-T5. A nurse is about to perform an upper respiratory exam on a patient with sinusitis. Which of the following sinuses are inaccessible for assessment by physical exam due to their placement deep within the skull? A. The maxillary and frontal sinuses. B. The maxillary and sphenoid sinuses. C. The ethmoid and sphenoid sinuses. D. The frontal and ethmoid sinuses. The answer is C. The ethmoid and sphenoid sinuses. The only sinuses that can be assessed on physical exam are the frontal and maxillary sinuses. The sphenoid and ethmoid sinuses are too deep in the skull to be assessed via physical examination.